Hi everyone, Dr. Barsgar here. I'm a general dentist with expertise in dental implants in the beautiful Washington, D.C. area. And today in this video, I'm going to be sharing with you some of the deepest insights I can give you as a dental professional. I'll be sharing with you the top 5 questions you should be asking your dental implant provider before committing to surgery. This will help you determine the credibility of your doctor on a deep level in a very short time. All right, you're back. Let's dive right in. Question 1. What is your provider's formal education in dental implantology? Who were they trained by? What form of training did they receive? How long did it take them to get through that training? These are all questions related to the formal education of the dental implantologist that you're going to see, and they're really, really important. For example, I've gone to multiple continuing education courses where I've studied under board-certified surgeons on how to place implants. I've also done 1 year of residency specifically for placing implants. This means I devoted hundreds of hours taking notes, learning every single possible complications that can occur with dental implants. And then I had to pass rigorous exams that were proctored by other implantologists who were overseeing my apprenticeship during this program. So as a person looking for implants, make sure you ask for the formal educational background of the dental provider. And if they don't have an extensive amount of formal education, I would even go as far as asking for a guarantee for the implant. You want to make sure the person that is placing your implant is credible. Question 2. Does the dentist use a reputable implant company? This is something that most patients don't understand and don't ask, and it's a very, very important question to ask. It is critical that a company is used that has been reputable and has been around for a very, very long time. Let me explain. If an implant has been done a long time ago and that company is not around, the parts for that implant are no longer available and other parts cannot be used. So you don't want to have an implant in your mouth that the parts are not available in case something goes wrong with the implant and the parts need to be replaced. So this is a very, very important question to ask your dental provider. Is the company that they're using a company that has been around for a long time and it has credibility and their products have been around for a long time? Remember that this implant that is going to be placed in your jaw is going to be in there for the rest of your life. So you want a company that is going to be also there if these parts need to be replaced. Question 3, will the dental implant and the crown be placed in the same office? So in many general dental offices, they separate the dental implant process among 2 dentists. One dentist will be the actual surgeon that will place the implant in the patient's bone. The other dentist will be the one responsible for placing the crown on top of that implant. There's nothing wrong with this approach as long as the doctors work closely together on this approach. I've seen some weird cases where the patient went to one office and got the implant placed in that office, then went entirely to another office to get the crown put in that office. The end result was a weird looking crown. The patient did not like the way the crown looked because the doctors were not able to effectively collaborate with each other. So I recommend working with a dental provider that does the whole process in one location where the implant is placed and also the crown is placed in that same location. That would be the best way to do this process. This will decrease the margin for error and increase your chances of getting a perfect implant crown. Question 4. How will the dentist take into effect your specific medical conditions? The success of your implant surgery will largely depend on how your doctor takes into account your medical conditions. For example, people who have diabetes will have a much harder time healing after dental surgery. The health condition of the patient is critical when you're placing implant, just like any surgery that you would have in a hospital. Basically, the body has to be in a good condition. There shouldn't be any infections. The healing process of the body should be very, very good so that it can recover from surgery and quickly heal the body. The whole implant takes time and uses the body's own mechanism to heal and fuse with the body and fuse with the bone. So if that process is not very good, let's say you have a medical condition that you cannot heal, you're immunosuppressed, or you have diabetes that is not under control. So these things need special attention, and a doctor who has experience doing these kind of things will be able to help you get a successful result and be able to get implants. Question 5, how accessible will your surgeon be after surgery? This is an absolute must. The fact of the matter is there's a small chance that something unexpected may happen after surgery. The implant provider may have done everything perfectly, but for some reason, your stitches might have come out a week later. And now you're freaking out that your implant might fall out or your mouth might get infected. What do? Can you call your surgeon and get it taken care of? You should have your surgeon's word that if something goes wrong, they'll prioritize your case. I also want to add a side note here. This is one of the reasons I get very concerned when I hear people wanting to go to another country to get implants. If something happens when they get back into the United States, they're going to have some serious logistical issues. If you get an implant done in Mexico or in India, come back a couple of days later, you'll have to fly all the way back to get the issue fixed. That's a problem. Anyway, that concludes all of the content. Those are the top 5 most important questions you should ask before committing to surgery. I hope this gave you insights on the variables you should consider as a potential implant patient. If you found this valuable, go ahead and give this video a thumbs up and share it with your friends. Until next time, this has been Dr. Barsgar with Cherrywood Dental Associates in the beautiful Washington, D.C. area.